trust in data is no more about data team taking care of that, but it's actually a board level, and it's more importantly a patient impact concern for organizations today.
So if you get the data trust right, anything else like the AI, the analytics, the innovation becomes much easier and more reliable.
Welcome to Shaping Healthcare, a podcast by CitiusTech. I'm your host, Laurel Rockel. Healthcare organizations today are operating in an environment where data drives nearly every clinical, operational, and strategic decision. But the ability to trust that data remains one of the sector's most persistent challenges. Questions around accuracy, consistency, and reliability continue to affect everything from patient care to organizational performance. To explore what it truly takes to build trust in healthcare data, we are joined by Gaurav Shrimal, AVP of Quality and Validation at CitiusTech, and Anand Rao, Vice President of Marketing at Datagaps. In this conversation, we will unpack why data trust matters, the barriers that organizations commonly face, and how leaders can move towards data that is not just available, but dependable and decision-ready. Gaurav and Anand, thank you for joining me today. Welcome to the podcast.
Thank you, Laura.
Thank you. Great to be here.
It's great to have you. I'm looking forward to our conversation today. I want to start with the phrase trust in data. Gaurav, how do you define that phrase, trust in data, within a healthcare context? And why has that become such a critical priority for healthcare organizations today?
Sure, Laurel. So, in healthcare, trust in data is not just about the correctness of the data, it's also about the confidence that the data is accurate, it's complete, it's consistent, it's being delivered in a timely fashion, it's secure, and more important, it's fit for purpose across the entire life cycle. Now, whether that data is driving your clinical decisions, is driving payer reimbursements or regulatory reporting or AI models, organizations need to ensure and have that confidence that it represents the reality of the world. Why it has become critical? Because increasingly the organizations are becoming more data driven and automation driven. There's a substantial increase in usage of analytics, AI in delivering population health, value-based care, and also delivering the right digital health platforms. Now, because of this, there has been a substantial increase in the data ecosystem as well, and it's becoming very, very complex as we go day by day, right? So there are multiple source systems. You're seeing a lot of cloud migration, data migration programs. There's third-party data that is coming into picture. Then, of course, there are real-time pipelines that come into picture. So if you can't trust the data, the downstream impact is going to be enormous because it can lead to your incorrect clinical insights. It can lead to claims being denied. It can lead to compliance risks, broken AI models, and most important is it can actually impact the overall patient outcome. So trust in data is no more about data team taking care of that, but it's actually a board level, and it's more importantly a patient impact concern for organizations today.
Yeah, absolutely. Incredibly critical once you list that all out. And also, as you mentioned too, that everything is becoming more data driven. So when we talk about trusted data, Anand, what does that actually involve? What are the main things that organizations need to then get right in order to build that data trust into their healthcare?
Yeah, absolutely. So I'd like to build on what Gaurav just mentioned about confidence in data. So when we trusted data in healthcare, we're really talking about confidence across the entire life cycle. So not just whether a data set is clean at one point in time. Trust is built when the data is consistently accurate, explainable, and reliable from the moment it enters the system all the way to the final clinical or operational decision. So I would break it down into 5 different areas. So first is it starts with the validation at the point of ingestion. So Gaurav touched on this a little bit, where healthcare data comes from many different sources, electronic health records, claim systems, labs, now even variables. So if you don't validate the completeness, the formats, the standards upfront, errors propagate quickly. The second area is the trust depends on the transformation process that the data goes through and that integrity of that process. So as the data moves across the pipelines, there are several things that happen to the data. It's joined with other data, it's aggregated, there are mappings and other logic errors that could happen, and this could create a downstream impact. So organizations need automated reconciliation processes to ensure that the source to target accuracy is maintained at scale. The third area is we need continuous monitoring. Data is not static. Patterns change, patient volumes change, claim values, treatment trends. There are so many things that are changing. So without monitoring for drift or anomalies, there are several issues that go unnoticed until they impact the reports for patient care. The fourth area is business level validation, which is critical. It's not enough that the data is technically correct. It must also produce the right KPIs, the right dashboards and insights. And so it's the clinical quality score, or if the risk model is off based on that score, decisions will be off. And finally, the governance and lineage of that data complete the picture. So teams need to know where that data came from, and I mentioned the different sources, what changed, who touched it. So that transparency builds accountability. So here at Datagaps, we think of trust as something that you operationalize and not assume. So when these layers come together, organizations move from data just being available to data being dependable, and which is what healthcare systems truly need.
That's excellent to talk about it in 5 steps like that, from the very beginning as it comes in, making sure that you can trust the data as it comes in, and then checking that along the way, having a system of checks and balances as it goes through the life cycle there. And Gaurav, from your experience, what makes it difficult for healthcare organizations then to build that trust into their data? And what are those issues that are usually getting in the way along the way?
Oh, very, very good question, Laurel. And I think with the kind of data that we are looking at, with the volume of data that we are looking at, it's a very pertinent question as well. Now, I'll break it down into 3 major challenges that we consistently see across the organizations. First and foremost, there are so many applications, so many systems, so there is a lot of fragmentation of the data. So you have healthcare data which is coming across your EHRs, payer systems, lab systems, imaging systems. There are various external partners that are providing the data to the organization, and everything is in a different standard, everything is in a different structure. So that poses one challenge to the organization. Secondly, there is a scale and change. There's continuous change that is happening in the organizations. Continuously, organizations are modernizing. They're moving to cloud platforms. They're onboarding new vendors. They're enabling new analytical use cases altogether. So that means your traditional manual validation cannot simply keep up with the pace of the change. And the third one is lack of continuous validation. So a lot of organizations rely on just point-in-time testing just before the go live, which doesn't really cut through. Because your data is changing on a daily basis. Without automation, your ongoing data quality and reconciliation checks will not happen properly, and that's where your trust erodes very quickly. On top of it, you have regulatory pressure, right? So you have HIPAA, you have CMS, you have audits that keep coming in. So margin for error becomes very, very small. So that's where healthcare organizations struggle to sustain the data trust, even if they have invested heavily in data platforms and data modernization exercise.
There are a lot of different steps throughout that, of course, and as you mentioned, all those different challenges. So with all these things to have to keep an eye on and keep in check, from a technology and innovation standpoint and through that lens, Anand, how can modern approaches help healthcare organizations overcome these data trust challenges?
Yeah, absolutely. So Datagaps is a technology platform, and these modern approaches, the cloud that Gaurav mentioned, the automation and AI, are changing how healthcare organizations build and sustain this data trust. So let's start with the cloud platforms. So technologies like Snowflake and Databricks allow organizations to process massive data sets in parallel. And this means that the validation can happen at the complete scale, not just on samples of data. So instead of checking, say, 1% of the records manually, you can validate the complete 100% of the data automatically, which dramatically improves the confidence in the data. The next is, and Gaurav touched on this, is the automation of this data validation. So traditionally, testing was manual, it was fragmented. So today, we define reusable rules and templates that run across the ingestion, transformation, and reporting layers that I alluded to in the previous answer. And this turns data quality into a repeatable system rather than a one-time effort. Then comes the AI-driven acceleration. So AI, ChatGPT and Claude and other systems, and now we are incorporating this into several of these data quality platforms, can now generate the validation logic, suggest the test cases, and even detect any anomalies that rule-based systems might miss. So for example, if claim patterns or patient metrics shift subtly over time, machine learning models can flag those changes early before they become major changes. Another important innovation is data observability. So instead of waiting for failures, organizations can continuously track data behavior, the volume of the data, the distribution of this data, and other trends, and get proactive alerts when something deviates from the expected patterns. And finally, there's this whole concept of synthetic data. So healthcare, as Gaurav mentioned, has strict privacy requirements such as HIPAA. So testing with real patient data is risky. And so synthetic data allows teams to test thoroughly without exposing any sensitive information while still maintaining those realistic patterns in the data. So at Datagaps, we see these innovations working best together as part of a unified approach. And the goal is to move from any kind of reactive firefighting to proactive automated trust in the data at scale.
Thank you. Yeah, I want to dig into that a little bit deeper, like the actual processes of that. And Gaurav, as an IT services partner to many healthcare organizations, how are you helping clients bake that trust into their data ecosystems? And what practices or frameworks have you found that are effective in building and sustaining high quality data and security in large healthcare settings?
Yeah, so Laurel, in fact, what Anand just mentioned is about making sure data trust is not just a one-time project, it's a discipline across the entire life cycle, right? And that's what in various shapes and formats Datagaps is doing today. So as an organization, we are helping our clients in embedding trust across the data lifecycle. So starting from data ingestion, transformation, to analytics and AI consumption, to even your operational and regulatory use cases. What this means is we need to design the data quality and reconciliation frameworks which are aligned to the business rules and regulatory expectations. It also means that we need to implement an automated data testing and continuous monitoring, and not just do testing before the pre-go live, right? That's something that we need to avoid. Governing the whole procedure becomes very important. Governing the whole data becomes very important. That's where we bring in clear ownership, lineage, and accountability of the data itself. Now, validating data is not just about validating only for the reports that are being generated finally, but it's also about in between what is happening. So that's where validating it for your AI ML models, for risk adjustment, for quality reporting, and various other use cases that come in between. So overall, when we are looking at data validation, it has to be aligned to the business outcomes and not just become a technical matrix that you monitor.
I'd like to look at that partnership, that especially between both in your relationships that you have and what you're both doing. Can you explain further, Anand, how partnerships between specialist data technology providers like Datagaps and then healthcare-focused IT firms like CitiusTech help accelerate that journey towards that high-quality, trusted data for healthcare clients?
Yeah, absolutely. And we really, like this partnership. And this is where things get really interesting because technology alone is not enough. So building trusted healthcare data requires both deep domain expertise and strong engineering platforms. And that's exactly where partnerships like Datagaps and CitiusTech come together, where CitiusTech brings the healthcare specific knowledge, understanding the regulatory requirements, the payer to provider workflows, the clinical quality measures, and all those nuances of claims and patient data. And they know where things typically break, what good looks like from a healthcare outcome perspective. Datagaps, on the other hand, complements that with a productized data ops platform that automates the validation, the reconciliation, the monitoring across the entire data pipeline. So instead of building these one-off scripts or manual checks, organizations can standardize how trust is enforced at scale. And so together, this creates a powerful model. CitiusTech helps define what needs to be validated based on real-world healthcare scenarios, and Datagaps enables how to validate it consistently and automatically. And both teams ensure this alignment between technical accuracy and business correctness. So this partnership also speeds up any kind of transformation initiatives, say like cloud migration or new data platform rollouts. So instead of taking months to manually verify this data, automated validation frameworks ensure that this is faster and more confident transitions takes place. So another big advantage is this end-to-end visibility. As I said, from ingestion to dashboard, organizations get this clear picture where issues occur and how to fix them quickly. So overall, this partnership reduces risk, accelerates delivery, and more importantly, builds confidence across teams. And that's what ultimately drives adoption and trust in the healthcare data systems.
Yes, it sounds like a very perfectly complementary partnership and taking care of all those challenges with data, from end to end. And also, what are some of the challenges and the solutions that were implemented, and what results did you get from that?
Oh yeah, absolutely, Laurel. We do have a very good success story around this. So this was a large healthcare organization. Again, they were undergoing a cloud data platform modernization, and they had to support various critical regulatory and analytics workloads across that data pipeline, right? So the challenge was they had multiple downstream teams, finance, compliance, analytics, and they were all seeing conflicting numbers while they had the same data platform, but the numbers were very different for each of the teams, which was leading to that distrust and manual reconciliation on a regular basis. So we worked with the client, we helped them implement an automated data reconciliation and quality checks from source to target. They were following a medallion architecture with bronze, silver, gold layers. Across each of the layers, we've implemented various data quality checks. And we've used Datagaps in this particular case from an automation perspective to implement those checks at different layers. And each of the layers had different types of checks. So While at the bronze layer, it was primarily about making sure from multiple sources we are ingesting the right data with all the null checks, etc. But at the silver layer, there were complex business rules that have to be checked. And finally, at the gold layer, we had to make sure that everything is getting reported properly in the final reports that are being generated. So, outcome, of course, was substantial. The reconciliation cycles, which could have taken weeks, were reduced to hours. Finally, the reporting teams regained confidence in the dashboards that were being sent across to them. The audit readiness improved dramatically. Most importantly, what we saw was the business users stopped questioning the data and started using it to drive their decisions. So that's exactly when you know that trust has been truly established in the data that you provided to them.
Absolutely. And now, as we look ahead, what emerging trends or future developments do you foresee in the realm of data trust for healthcare? And what is one piece of advice that you would give healthcare data leaders seeking to strengthen their trust in data going forward?
Yeah, absolutely. And we have talked about several things. So maybe I could sum it up and as three major trends shaping the future of data trust in healthcare. So first is this shift towards continuous data trust that we have touched on previously. So instead of periodic checks or audits, organizations are moving to always on validation and monitoring. And so think of data pipelines like production systems with built-in testing, alerts, and SLAs associated with those pipelines. And the second trend I see is the rise of AI-assisted data engineering. So AI at this point won't replace engineers, but it will significantly accelerate how rules are created, how anomalies are detected, and how insights are generated. So this will reduce the effort while improving the test coverage of data. And third is this whole convergence between data ops and data observability. So organizations will no longer treat data quality, testing, and monitoring as separate functions. They will be unified into a single operational framework focused on reliability and trust. Coming to the second part of your question, my advice to healthcare leaders is very simple. Don't try to do everything and fix everything at once. Start with your highest risk areas, maybe the claims data, maybe the clinical reporting, or a migration project that we had in our case study earlier. Then you validate the data early at the point of ingestion, you reconcile the data as it moves along the pipeline, you monitor continuously for data drift, and automate whenever possible. So also, you need to align your teams. So the data engineering, the analytics, the business stakeholders, all of them need to have a shared definition of what trusted data means to them. And at the end of the day, this data trust is not a one-time project, as Gaurav alluded to. It's a capability you build over time. And in healthcare, this capability impacts the patient outcome, any kind of compliance, and the overall operational efficiency. So if you get the data trust right, anything else like the AI, the analytics, the innovation becomes much easier and more reliable.
So if I may add to that, Laurel, in one sentence, if I have to say, at the end of the day, data trust is not just about better data. It's about better decisions that you can take. It's about better compliance. And ultimately, what you're looking at is better patient and member outcomes.
Yes. Yeah. You've both touched on some really excellent points there and some advice as well. Don't do it all at once, monitoring your data as it goes along and along the pipeline and getting your teams involved. And Gaurav, yeah, you're exactly right. Especially as in our conversation today, we've spoken about how incredibly important that data is and making sure that it is can be trusted and monitored through that pipeline. So that way outcomes for ultimately the patient and those using this data can be trusted and be used appropriately going forward. So thank you very much. And thank you for your insights around trust in data. It's certainly a very critical thing to be looking at. And it sounds like together making that happen for your customers and clients. So thank you very much for joining me today, Anand and Gaurav.
Thank you.
Thank you.
The Shaping Healthcare podcast is brought to you by CitiusTech, a leader in healthcare consulting and IT services. To find out more about CitiusTech, visit CitiusTech.com. To listen to more interesting insights on healthcare technology and innovations, search and subscribe to the Shaping Healthcare podcast. Thank you for listening. If you want to share any feedback or would like to be featured in our podcast, do write to us at citiusvision@citiustech.com.